So on my last microneedling with radiofrequency review video, I kind of covered the what, why, and before and after videos and pictures. I had a lot of questions about RF microneedling and people also wanted to see the procedure. So I'm going to show you the whole procedure today with my esthetician Kevany, and she's going to answer all of your FAQs in there, kind of like the difference between regular microneedling and microneedling with RF, what you can do if you're worried it's painful to kind of for her to help reduce the pain for you, and a lot of kind of the aftercare, the post-care things you should and shouldn't be doing, because that's kind of one of the main things people want to know. Also the downtime. So I had my treatment done on Thursday. We are now on Sunday. So 2 days, no makeup. Now I did just do a spot treatment this time. We'd already done 3 sessions. This was my 4th, and we just went over my scarring and my biopsy scars. So there wasn't as much downtime except for the 2 days off. I have a few kind of track marks still that you can't, come really close again, see with the makeup on. So really quick recovery for this, and I went pretty intense with it. We went from the 25 needles to 49 needles. But anyway, I'm going to show you the machine, I'm going to show you the needles, I'm going to show you how microneedling with radiofrequency works, how she can change the intensity, and all the good stuff. Heads up, if you don't like needles or you're squeamish, this might not be the video for you, and you might want to fast forward to the end, because we are going to show you the treatment and we are going to show you the needles. So how do you prep the skin for the microneedling with RF?
You just want the skin to be extremely clean. So I remove all the numbing cream off, and then I'm going to cleanse and follow up with a little, either like an AHA toner, depending on the skin type, or straight alcohol, just to make sure that I have no residue on the skin. You have to think these little needles are going in, and whatever's on the topically on the skin, it can be pushed in. So to avoid any potential like breakouts or even infection, you know, who knows what's on there, you really want the skin to be clean. If the skin's too dry, if I'm doing someone with really dry skin, I try and stay away from the alcohol, but just because the dehydration it can cause. And then on your end to prep, you're going to discontinue, you know, all of your active serums. You want the skin, you don't want the barrier to be compromised. So like retinols, alpha hydroxys, beta hydroxys, anything that's aggressive, you want to stop a couple weeks before.
I think it's the tanning that's the hardest for me to give up. I'm such a self-tanner. Like my
Yeah.
arms are a totally different color to my face right now. So I'll do the rest of my body and just match my face up with my makeup.
Okay. A little strong. This is the alcohol. And I'm going to hand you a mirror. I just want to make sure we're on the same page with what we're treating.
So we've already done 3 of these treatments. This is just a final touch up on the scars because they were my main areas of concern.
Okay, I'm going to give you this. And then right over here, we're going to do you want me to work through the pores again?
No, those are good. I think just that scar there.
Up here?
And then this one here.
Okay, and I'm going to go over this. Do you mind?
No, it's good.
You're fine?
So I have some keloid scars here that the RF is really good for dealing with.
RF, like microneedling, the needles insert the skin, causing little micro wounds, and that in itself breaks up scar tissue. So any kind of scarring, whether it be from acne, an accident, surgery, anything, it breaks up that scar tissue and allows the skin to heal. The bulk heating pretty much just sets that dermal layer on fire, really just ignites the whole process of collagen induction therapy. So in doing so, it's going to push forth such growth in the skin that helps. So you're breaking the scars up from the top and regenerating them from the bottom. That's why I love this treatment for scarring.
Are there things post-care you think that really help the treatment, like are collagen supplements worthwhile?
I think collagen supplements are excellent. I don't think that they are doing anything crazy for your own skin's natural collagen supply. I do not think that. But taking a collagen, especially like a bovine, because it closely mimics our own collagen makeup, like a plant collagen, I don't think is the best option. But like a marine or a bovine, I do think that it helps your skin's health overall and your joints and all of that. So I'm all for it, but I try to be realistic in what it's going to actually produce. So, And will it help your healing process? Absolutely. I think that topically, you just want to treat your skin like a baby, like using barrier repair like Aquaphor. My slugging, yeah. My personal favorite treatment for that is Biogel by Antage. It's just full of growth factors. We were treating you with 25 needles, and now today we're going to do it with a few more. The reason we did 25 was simply because it's less downtime. Still same kind of response, but a little less aggressive. So since we're just spot treating, I think that it's a good idea to try the more needles today.
And then for people who are kind of worried it's painful or have a lower pain threshold, there are recommendations, things you can do to kind of make it more comfortable?
It is heat, it's fast. I also have a cold hammer that gets really, really cold, but I have my sensitive clients, I have them hold it and ice the side of their face while I'm treating this side, and then I swap. It does help them a lot, and I can even get a Valium for them if they think that. If that's the case, I do require you to have someone drive you home. But if you're really that worried about it, then...
And you can change the intensity, right?
You can change the intensity. I can change the depth of the needles. I can change the intensity of the energy being delivered. I can change how hot it is, how long the heat stays on your skin. So there's a lot of different elements I can change.
If people are doing it less intense, they generally need more treatments.
Yeah, you do. The more intense, I'm not always like intense is better. But if you want to just get it over with, it's, that's an easier thing. With these treatments, a minimum of 3, depending on the severity and what we're actually treating. But I wouldn't do more than 6 in a row. That's just my own personal preference as the practitioner. And then I'd space them out like every 3 or 4 months for maintenance until we got the desired results. But you're going to see a significant difference with 1, 2, 3 already. You're going to see a change in the skin.
So what are some of the results that are permanent and which ones that are more temporary?
The temporary is going to be that kind of glow you get, that that refined appearance. Our skin cycle is going to change, and you're going to have dead skin cells all over again. So that rejuvenated appearance is a temporary thing. The fine lines in that, the ones that they're combating and we're treating, that collagen induction therapy is going to soften those. The aging process still continues. This doesn't stop the aging process. So
what about the pore size? Is that kind of temporary?
Pore size, it is and it isn't. Immediately what you see after you get done is a combination of kind of the swelling, the skin regenerating itself. But as time goes on, our pores can refill. Like a pore size is a pore size. What you're doing deep inside the skin can help that appearance of those, but they will refill. I don't ever think they return back to their original size, especially with continued treatments and maintenance. But the immediate result you get, they will increase a little bit from that.
Healing from the scarring is permanent.
Yes, absolutely. Okay, I'm gonna come right here and start right on this one first. You ready?
Mm-hmm.
1, 2, 3. You okay?
Yeah.
Okay, great.
I'm very jumpy as well, so if you see me jump on camera, it's not just Kevin. It's like just when someone goes to my face.
I'm not going to just go directly on top of this. I'm going to kind of go around it a little bit just to kind of ignite the whole area. One more. Okay.
The main thing for me, I feel, is the heat more than the
needles.
Mm-hmm.
And most people tell me, like, it feels like there's just one needle in there.
It does feel like just one really hot
needle. And there's 49, in fact. That's the RF. So the light there is the energy being delivered. When the needles reach a certain depth, you can, that's when it automatically delivers the RF. So I have it set to how deep I want it to go. And you can see all those little needles. One more, okay? I'm just kind of waiting to see clinical endpoint. I've seen it. You're red. You're kind of patched up and swollen in those areas, but I just want to watch it, see if I should hit anything else again. I'm going to also show you right here. I'm not seeing the redness that I'd like. I'm going to show you too and just make sure that, again, we've hit the right spot. I'm going to take these off.
It definitely felt the most intense it's felt.
So I hit up here in this area for that pore and on the chin.
And the scar as well, you got that one?
Yeah, right up here.
Cool. Yeah.
Good. Perfect. I think aftercare and recovery is probably what people stress out about the most besides pain. People are always like, how bad is it going to hurt? But aftercare is a strict 48 hours, no makeup, no sauna or steam room, anything that's going to cause excessive sweating. People ask me all the time, can I just walk? I'm okay with that as long as you're not doing it in broad daylight in the middle of summer. You want to avoid heat and sun. Right now it's not hot out, but the sun is out, so you can protect yourself from the sun and the heat isn't a factor. Once we get into summer, this isn't a treatment that you have to avoid in the summer, but you do have to be cautious with it. So heat and sun, 2 weeks, excessive sweating, I say at least 4 days. Your active ingredient products need to be avoided for 7 to 14 days, and tanning, that kind of thing. Result wise, you're going to get a little grid mark like pattern where the needle's entered. They can have texture almost like a scab. You have to leave those alone. You won't mess with them. Let them fall off naturally.
And I'll show you the after tomorrow so you can see the grid mark she's talking about.
And, we just spot treated Eve today, but normally this would be all over. You can get swollen. That's totally normal. All of that kind of stuff, So you do need to kind of prepare for at least 2 days of, and depending on how deep we go as well. You want to prepare for 2 days of redness. You want to prepare for about a week of little dots. Like after that 48 hours, you can attempt to cover them with makeup. You're just going to be using gentle products. You're going to gently cleanse. I really like vinegar soaks. Putting a little
white vinegar?
Yeah, white distilled vinegar. It just keeps the skin very sterile.
So you use it like a toner?
Yep, you will dilute it in a little water, take like a little cotton round and cleanse the skin that way. If you're worried about your cleanser especially, and you can always send me your cleansers. I know what you're using and have approved it, but if you don't have a cleanser, you don't want to get a cleanser that's gentle, then I always direct them to that, just because the vinegar really will keep it sterile. It might have a little sting to it. It's safe for the skin though. And then when I do this myself, I use nothing but like an Aquaphor type product, like your slugging products, right?
For 48 hours.
Mm-hmm. Yep. And then after that, you can go to a normal regimen as long as there's no actives in it. And then in about a week to 2 weeks, you can start using the actives again.
So excuse the really shiny look, but I wanted to kind of show you the day after, what to expect. Ignore these. That was a totally separate treatment we did to remove some kind of like lumps I had, something going on there with like blocked pores. So I want to show you, we just did the spot treatment, right? So we did this area around the scar, these 2 areas here, and this keloid scar here, as well as my biopsy scar. I'm gonna put a little picture here of the biopsy because we went deeper there, and this is kind of like the grid mark that sometimes you might get on your face if you go more intense. I didn't get that on my face. I just got it there where we went really deep. You can slightly see it here. I'm getting really close, so I've got like no makeup on, so bear with me. Like I'm putting myself out here a bit here. There are very, very faint grid marks there. You really can't see. It is slightly red there. I had a slight breakout because, as you can see, I've been using a lot of scar cream on them and then slugging at night with Aquaphor, and that has made me break out. And then I've been doing it in the areas I had it done because obviously these scabs I'm trying to keep dry. So there's a lot going on right now. I've got kind of like the biocorneum scar cream on these areas, and she went slightly wider than the actual scars itself because obviously it's collagen induction. Rather than just doing that area, she's tried to get the whole area around it, so really, really thorough with that, which I love. And then the breakout there is causing the redness rather than that actually being from the treatment. So basically tomorrow when I put makeup on, well, 48 hours later, you're not even going to see that. You're going to still see the scabs, but that is not the microneedling with RF. That's nothing to do with this. So with makeup on, easily back like zero, literally 2 days downtime. I could have still gone out like this. It's not a big deal, but if you're wearing makeup for work, maybe you want to wait the 2 days, but very, very minimal redness, very minimal swelling. Is it painful afterwards? It really, I mean, it's a little hot, I would say. I just felt really hot and flustered afterwards. I didn't feel any pain as such afterwards. If you have any questions, drop them in the comments below, and myself or Kevany will get back to you with the answers. She is obviously the pro esthetician with all the answers. Mine will just be personal feedback on this, but I wanted to do a follow-up from my original video just to kind of show you now after the 3 sessions. This was session number 4, just to spot treat these areas and just to answer all the questions we got from the original video as a little follow-up. Thanks for watching. If you like this video, don't forget to give it a quick thumbs up and subscribe.